Hello and welcome to Pregnancy Info. Today we will discuss the do's and don'ts of second trimester of pregnancy. Pregnancy is a beautiful phase of every woman's life. As they step into motherhood and before your little bundle of joy arrives, as an expecting mother and expecting parents, you are responsible for helping them grow in a nurturing, healthy environment. This beautiful phase comes with many questions in terms of what you can do and what you cannot. Panic not, we have a list of guidelines for you on the do's and don'ts for each trimester, but there are no substitute to consult your own doctor regularly. The second trimester. Many women are delighted to reach the second trimester during the 13th to the 28th week of pregnancy. Your baby bump may be starting to show, and unpleasant symptoms like extreme fatigue and morning sickness may be going away. Lots of women report that this is their favorite time of their pregnancy journey. It's even called the golden period by some people, with less nausea, better sleep and more energy. So, now we will discuss the do's that you must have to do in the second trimester of pregnancy. Number 1. Eat healthy foods. Your healthy food can help provide your growing baby with all the nutrients you need during your second trimester of pregnancy. Some good choices to integrate into your diet includes vegetables, dark leafy greens, carrots, tomatoes, sweet potatoes, and red bell peppers are high in vitamin A and potassium. Fruits, melons, mangoes, apricots, oranges, bananas, and apples have lots of good fiber, are hydrating, and vitamin C. Dairy, eating low-fat yogurt, drinking reduced-fat milk, and small amount of cheese products provide calcium, potassium, and vitamins. Whole grains may provide both iron and folic acid in addition to healthy fiber. Proteins, beans, peas, seeds, nuts, low mercury fish like trout and salmon, lean beef, lamb, pork, and tofu all provide important proteins. Some healthy and satisfying snacks choices during the second trimester include smoothies with yogurt, fruit, and leafy greens, raw nuts including almonds, peanuts, walnuts, and cashews, vegetables dipped in hummus, fresh fruit. Take prenatal vitamins. Prenatal vitamins are different from everyday multivitamins. Your body's needs change when you're pregnant, and your growing baby has specific vitamin needs too. Just like during the first trimester of your pregnancy, your body and your baby needs these important vitamins. Prenatal vitamins include all of the calcium, iron, zinc, folate that you need. Folate is important because it helps to prevent some common and serious birth defects including spina bifida and anencephaly. Stay active. If you had a regular exercise habit before your pregnancy and through the first trimester, it's important to keep your level of activity up. The benefits of exercising through your second trimester pregnancy and beyond includes decreased stress level, balanced mood, reduced fatigue, reduced excess weight gain and gestational diabetes, improved sleep and minimized insomnia, reduced back pain. Some safe and healthy choices of exercises during your second trimester includes walk, jog or run if you practiced this prior to pregnancy, yoga, swim, lift light weights. Stay hydrated. Hydration is important for everybody, whether you're pregnant or not. Staying hydrated throughout your pregnancy can help you prevent many conditions include headaches, dizziness, kidney stones, constipations, and even preterm labor. How much water should you drink during the second trimester? Doctors recommend drinking between 8 to 12 cups of water each day. Other hydrating choices include sparkling water, herbal tea, juice, soup, and many kinds of fruits. Avoid drinks with caffeine or lots of sugar. Get plenty of sleep. Though you may not feel as exhausted as you did during the first trimester, it's still important to get as much as high-quality sleep at night as you can. Aim for 8 to 9 hours daily. Additionally, setting aside time to nap or rest during the afternoon can be helpful too. The key is to listen to your body and rest when you feel like to do this. Visit your doctor. If your pregnancy is going well, you should see your doctor once a month during the second trimester. Bloody vaginal discharge or swelling of hands or face are associations for an uncasual visit to the doctor. Undergo second trimester screening tests. Ultrasound, week 18 to 20, the doctor will examine the placenta, the fetal anatomy, activity, growth rate, and blood circulation, as well as determine the amount of amniotic fluid and the length of the cervix. Blood test, week 15 to 20, ideally 16 to 18, to check the marker of genetic conditions or birth defects. If the results of the screening test differ from the normal, the doctor will recommend an additional examinations. Go to the dentist. It is very important to visit the dentist even if you have never had problems with your teeth and gums before pregnancy. The growing baby takes a large amount of calcium from your own stores, which can reduce the protective function of tooth enamel and lead to cavities. Hormonal changes can make the gums more susceptible to infections and or bleeding and swelling. If you notice any change, consult your dentist. The second trimester is the safest time for dentist treatment. Eat frequent and small meals. Hormonal changes during pregnancy can cause heartburn and constipation. If you bothers you try to eat small amounts of food more often, includes more fiber in your diet, and drink plenty of liquids. Watch your weight. Steady weight gain is an important indicator of a healthy pregnancy. Weight gain is influenced by the course of pregnancy, the body type of the woman, and the size of the fetus. Your doctor will constantly monitor this parameter and give useful recommendations. Talk to your baby. From approximately week 18, pay attention to what is happening in your tummy. Most likely, you will feel the first stirring of your baby during the time. This is how your little one will communicate with you, expressing joy, anxiety, and pleasure, and respond to your emotional state with active jolts or calmness. Talk to your child and you are likely to feel them respond. If at some point it seems that your baby's movement have changed, there are fewer or more of them, tell your doctor about it. Renew your wardrobes. Enjoy some shopping and buy special maternity clothing. You are likely to feel uncomfortable in your regular outfits, and wearing them can slow down blood circulation, provoke heartburn, etc. Use anti-stretchmark creams. Your tummy is growing and your skin is stretching quite quickly. Collagen and elastin fibers are breaking, which can lead to stretch marks. Each expectant mother has her own individual genetic predisposition to stretch marks, so it is difficult to prevent them. However, you can reduce the discomfort and unpleasant itching by moisturizing your skin frequently. Spend more time with your family. If you have an older child, he or she may experience anxiety associated with the expectation of new family member and the fear of losing your affection. Try to devote as much time as possible to your older child so that in the future her or she will more comfortable with the baby arrival. Do get a flu vaccine. According to the World Health Organization, women who are pregnant during the flu season should receive the vaccine. There is sufficient evidence showing that the vaccine is safe for a mother and baby at any stage of pregnancy, as it offers protection from what could be a severe illness in pregnancy. A flu vaccine does not contain the live virus, which means it cannot infect you, but does cause your body to build up antibodies and protect you when you are exposed to the live virus. Prepare bag for hospital, because in this trimester you are more active than the others, so it is possible to buy and purchase the things for your baby and prepare the bag for the hospital. Prepare your home to receive the new member. You may decorate it, or you may bring some new furniture and things you want to be. Identify people who can help you in an emergency, because you must need a helping hand in the pregnancy. Now, this is the time you can communicate and identify the people who can help you in this phase. Now we will discuss the don'ts, the things you cannot do in the second trimester or you should not do. During your second trimester pregnancy, your baby's brain and body develop quickly. Alcohol can cause serious damage to a baby's developmental brain. There is no non-safe amount of alcohol to consume during pregnancy. Possible symptoms of fetal alcohol syndrome includes abnormal facial features, small head size, low body weight, poor coordination, poor memory, difficulty with attention, hyperactive behavior, learning disabilities, poor reasoning and judgment skills, sleep problems, vision or hearing problems, problems with heart, kidney, and other organs. Don't smoke or use drugs. Smoking during and after pregnancy puts you at an elevated risk for miscarriage. It also puts your baby at an increased risk of birth defect, premature birth, low birth weight, infant death, and learning disabilities is also considered one of the most significant risk factors for sudden infant death syndrome called SIDS. Other controlled substances and drugs, including some kind of prescription medicines, can cause serious harm to your baby during pregnancy. Avoid all opioids and street drugs during all trimester of your pregnancy. Before using any medications, confirm with your doctor or pharmacist that is approved for safe use while you are pregnant. Don't drink too much caffeine. While experts suggest cutting caffeine out of your diet entirely, many agree that small amounts are safe. Caffeine found in coffee, tea, chocolate, and energy drinks is a diuretic, and it causes you to urinate more and makes you vulnerable to dehydration. It can also increase your heart rate or blood pressure, both of which could have a negative impact on your pregnant body. Don't eat dangerous foods. Some foods are considered dangerous. During the first trimester of pregnancy, experts recommend avoiding any form of unpasteurized dairy, processed meat, raw or undercooked seafood, eggs or meat, cold meat or meat separates, cold smoked seafood, unwashed fruits and vegetables. Don't engage in risky behavior. Experts also recommend avoiding risky behavior during pregnancy include diet or try to lose weight restriction, calories, or exercising too much can harm your body and baby. Use hot tubs or saunas. If your core temperature gets too high, it can cause birth defects or a miscarriage. Clean your cat's litter box. Cat feces can carry a dangerous parasites that cause toxoplasmosis. Get tattoos or piercing. The risk of infection, including hepatitis B and HIV, could affect your baby's health. Play rough contact sports. Activities that put you at increased risk of overheating or getting injured should be avoided. Don't take medications without consulting your doctor. Many drugs can easily pass through the placenta into the bloodstream of your baby. Therefore, before taking any medicine, you need to make sure it is safe and consult with your doctor. Don't let stress into your life. Even one of the happiest periods in your life can become complicated and stressful. Of course, hormonal changes can often influence your emotions and reactions. You may also face difficult situations, but you should try to keep stress to a minimum. Learn breathing and relaxation techniques. Try to concentrate on something unpleasant or example thinking about your baby. Share your feelings with your relatives and your doctor and learn to control your emotions and thoughts. Don't lie on your back for a long time. In the second trimester, expectant mothers are cautioned to avoid lying on their backs for a long time. The uterus is already quite large and can put pressure on the spine and the major blood vessels in that area. Sequencing such as important vessels as the inferior vena cava automatically reduces the blood flow to the heart. This can make the baby suffer too, as the little one will not get enough oxygen from the mother. Try to lie more on your left side. This position is considered the most favorable. Don't wear high heel. As your pregnancy progresses, you will have to give up high-heeled shoes. First, it is important for you. Your spine is continuously adapting to the increasing pressure, and uncomfortable footwear worsens its changes and support point of your whole body and affects the ligaments of the ankle joints. In addition, wearing stiletto heels can change the position of the uterus, which will be uncomfortable for the baby. If you are not ready to completely forget about your favorite shoes, try to choose those with a steady white heels no higher than 2 to 5 centimeters. Dental visits are linked to diagnostic procedures. It is better to avoid all dental procedures until after delivery, as dental X-ray and some dental medications can be harmful for the fetus. Travel is not recommended if you have certain pregnancy complications including preeclampsia, premature rupture of membrane, and preterm labor. Travel also may not be a good idea if you are pregnant with more than one fetus. Before traveling, schedule a checkup with your obstetrician gynecologist before you leave. Know your estimated due date. If you have a problem while you are traveling, your caregiver will need to know how far along you are in your pregnancy. Hope I have explained all the do's and don'ts in the second trimester of pregnancy. You must share this information with your friends and family members and also subscribe my channel. Thank you.